I'm a fellowship-trained breast surgical oncologist. I'm Dr. Amani Jambakar. And today, let's talk about choosing a lumpectomy for breast cancer if you have a gene mutation like BRCA1, BRCA2, or PALB2, which increases your risk of cancer in other parts of the same breast or in the other breast. This is a 42-year-old patient similar to patients my colleagues and I have seen in the past. She was diagnosed with a 1 centimeter ER/PR negative, HER2 positive breast cancer. She does have heterogeneously dense breasts, all this fluffy white tissue that you can see, and she does have a small cancer hiding in there, which is denoted by the arrow. She went to go see a surgeon who told her that technically her cancer was small and got an MRI to confirm that it really was only 1 centimeter, and it came back as 1.3 centimeters on MRI, but still well below the 2.5 centimeter cutoff the surgeon said that they were comfortable still doing a lumpectomy for. You can see looking at this mammogram that her cancer is small in comparison to the volume of breast tissue she has, so a lumpectomy is a feasible option and would still give her a good cosmetic outcome. She has a sister who was diagnosed with breast cancer at 50, and her sister had genetic testing which showed that she had a PALB2 gene mutation, and the patient had her own genetic testing done which showed the same thing, a PALB2 gene mutation. Her surgeon mentioned she had a 35% risk over the next 15 years of developing a second primary breast cancer, meaning a different unrelated cancer in the same breast or in the other breast. Her surgeon counseled her that if she chose a lumpectomy, that she would need to get MRIs and mammograms every 6 months, and she might be subject to more biopsies because she was so young at the time of her diagnosis, and radiologists would be looking hard to make sure that they didn't miss another cancer in someone that they know is high risk because of that gene mutation. Based on those odds, this patient did choose to do a lumpectomy and took chemotherapy as well as HER2 blockers afterwards, did undergo radiation, and 5 years later, she is still cancer-free and did not develop a second breast cancer.